guys, you're welcome to another edition of my program called Health Talk with Queen Nikki. As per popular demand, via my inbox for this episode, I have people ask me about malaria. Yes, malaria is not common in Western world, except people travel to Africa and some other part of African country that they come back with malaria. But no, we have some malaria too here in the Western world. So let's talk about the signs and symptoms. What are the signs and symptoms when somebody exhibits that you can tell that the person has malaria? But before we go, remember the best testing for malaria is you have to consult your doctor, let them refer you to laboratory where you can put your blood down, and then they will test for the malaria count so they can know the appropriate treatment for the malaria. Can be deadly. Yes, if it's untreated, it can be deadly. That's why we have to take it serious, and it's a matter of urgency. Okay, now what are the signs and symptoms? If you see people, it can vary from individual, but mostly children, we have to pay attention to them when they have malaria. Now, if you see signs like nausea, vomiting, diarrhea, body ache, shortness of breath, irritable, aching, body aching, headache, sometimes occasionally running nose, please take it serious, especially body ache and fever. Take it serious, and then call your primary care doctor or your doctor for the treatment. So what are the prevention, because this is area where I love, so like in people living in Africa, we have what we call cluster where water, they call it gutter. Okay, if you have it in your environment, please make sure you clean it regularly. This is where the mosquito usually lay their head on and reproduce and cause trouble for our health. So if you see it, please make sure you clean it very, very well. They increase in that environment. Also, what are the treatment that we can use, when you see individual with malaria? Make sure you have what we call malaria net repellent. We have it in Africa country, all over African country. Cover yourself or you sleep in it to prevent this mosquito from coming in, or you use mosquito anti-repellent for your body skin to help you. Or better still, make sure you look at these signs and symptoms and you call your doctor for treatment. Now, if you have fever, I have fever video that I did on my YouTube channel, Health Talk Queen 1 on YouTube, or my TikTok, Health Talk Queen, where I talk about fever management in children and also in adults. So if you have fever, you treat the symptoms as it comes. Now, better still, there's what we call anti-malaria drugs, which I don't like to talk about on my video, but you can talk to your doctor about it. They can give it to you to help to reduce malaria, or better still, the symptoms. So if you have body ache, make sure you hydrate yourself, you drink a lot of water, you rest, you use your medication, which is your anti-malaria medication, you use it. And then if you are in Western world traveling to African country, consult with your doctor. They can recommend medication for you that you can use to prevent yourself. But even though when you get there, still make sure you use all this repellent. Make sure you close your door when it's late at night so the mosquito don't come in. Use the repellent that you can use. And also, if you finally get exposed to malaria, treat it as the symptoms shows up. See, I always say something: health is wealth, knowledge is powerful. I'll be duetting and also reposting a lot of videos that talks about malaria and management of malaria. Children, they are very, very important to look out for signs and symptoms, especially in eye area that they have malaria. Also, pregnant women, and also elderly that, like the old grandma, the grandpa. You see, this three set of people: the pregnant women, children, grandpa, grandmas, they are very, very fragile, and we have to pay attention to them. But the bottom line is just make sure they rest, eat, and also treat the symptom. And the best thing, consult your primary care doctor for further treatment. Okay, and then once you know the signs and symptoms and the prevention, you good to go. Now I have this person come into my inbox and ask, do I need antibiotic? I laugh. See, I always say something. Self-medication is wrong. Stop doing self-medication. Consult your primary care doctor or your pediatrician for further treatment. You going to the chemist or going to the store to just buy medication and use without proper consultation from your doctor is very risky. It's very risky, except over the counter. There's what we call over the counter medication that you can use. But when it comes to sickness like malaria, using antibiotic, I'm not going to discuss about it. If you want further questions, you can come to my inbox, then we'll discuss further about it. But please stop self-medication. Self-medication can be dangerous. You have to follow your doctor prescription, or better still, even the over-the-counter medication you're using, follow the direction of the dosage, when to use it, how many you can use per day. Once you do this, you should be good to go. Health is well. Let's keep malaria out. And the only way we can do it is information. You can also get information from your local hospital, also on internet with nurses like me and doctor like me or healthcare provider like me that is talking about it. Listen, share, repost, and do exactly what they ask you to do in the video. Also, you can go to the library. We have books that support information about malaria and other health issues that you want to listen or learn about. So follow me on all my social media platform. Like, post, repost, share, turn on your post notification on YouTube. You see that little bird, turn it on, and you can see me when I drop a new video, so you can get a notification. On my YouTube is Health Talk Queen 1. Also on TikTok is Health Talk Queen, and my business backup page, Health Talk Queen backup page on TikTok, and also Instagram, Health Talk Queen, on Facebook, Health Talk Queen Nikki. Trust me, you will not regret it once you follow me on all my social media platforms. I do like health content. I'm a registered nurse here in United States, and I also have my online consultation, nursing consultation, where you can ask me questions by registering. You give you access to my nurse in Nigeria, and also me personally, where you have any health question or you want us to manage your hypertension, diabetes, name it, any depression, anxiety, we are there for you. Okay, I hope you with this, malaria is easy and simple to treat, and also it can be deadly, but be informed and be empowered. Okay, till I see you guys in my next health video. We don't know what it's gonna be, but please share to your loved one on Green Hub and all the social media platforms so they can be informed. So watch out for my next health video. You will love it. Till I see you guys in my next video, please remain blessed, and remember, health is wealth, and you're the only one that can take charge of your health by doing what? Eat right, exercise, rest, hydrate yourself, put on that smiling face, take care of yourself mentally, physically. Exercise is the key. Eating balanced diet with good vitamins, hydrate yourself, less carbohydrate, protein, vegetables, fruits. But if you cannot do that, like some people they can't afford it, use your multivitamin and rest. Okay, rest. Also, you can do yoga exercise. Okay, yoga exercise is also good for you. And remember, don't forget, when you are doing all those things, your mental health is also #1 priority. Till I see you guys in my next video, remain blessed, and let's kick malaria out of our society. Take care. Bye.